Turmeric has been extensively studied in the scientific community for many years and has always been declared non-toxic until recently, when dozens of cases of liver toxicity due to turmeric supplements have been reported. Turmeric has anti-inflammatory and antioxidant properties and has been shown to help with indigestion, diarrhea, liver disease, cancer, and joint health for conditions such as osteoarthritis. The properties of turmeric are mainly due to the curcuminoids, the main and most studied of which is curcumin, which represents about 80% of the curcuminoids. Turmeric powder naturally contains 3.14% of curcuminoids. So 10 grams of turmeric powder contains 314 milligrams of curcuminoids. When you consume turmeric supplements, they are usually very concentrated in curcuminoid, as they usually contain more than 300 milligrams, an amount that you would obtain naturally by consuming around 10 grams of turmeric powder, which is huge. Usual consumption in India, for example, is on average 1 to 2 grams of turmeric per person and per day. By taking turmeric supplements concentrated in curcumin, you therefore absorb a huge dose of curcumin, almost impossible to obtain naturally by simply consuming turmeric powder. This is an important detail that partly explains its potential toxicity, as we will see in this video. In addition, one of the main reasons for its safety is that curcumin is very poorly absorbed when ingested. However, means of increasing the bioavailability of curcumin were developed using piperine that is extracted from black pepper or nanoparticle delivery methods to increase absorption. These high bioavailability forms of turmeric were subsequently linked to several cases of liver injury and mentioned as a possible cause of outbreaks of acute hepatitis with jaundice in Europe, particularly in Italy and Belgium, but also in the United States. The cases of toxicity reported generally included the following symptoms: fatigue, nausea, poor appetite, abdominal pain, discolored stools, dermatitis, jaundice, and dark urine. Hepatic markers such as transaminase, bilirubin, and alkaline phosphatase were very high. Many patients developed autoantibodies, and the clinical syndrome and histological features resembled autoimmune hepatitis. However, patients recovered quickly once the turmeric supplement was discontinued. In the study I will talk about now, 23 cases were identified in Italy between December 2018 and July 2019. Of these 23 cases, the majority were taking at least one chemical medication in addition to the turmeric supplement, and 16 of them recovered after the supplement was discontinued. 7 cases were detailed, and we will see that now. Case number 1. It's a 55-year-old female who was hospitalized and diagnosed with hepatitis. She took 3 tablets a day of a supplement consisting of 400 milligrams turmeric dry extract and 90 milligrams turmeric powder per tablet. She was not taking any other supplement or medications, and she had not consumed any alcohol. Her symptoms resolved after 20 days of stopping the supplement. So 400 milligrams of dry extract of turmeric is more or less 300 milligrams of curcumin, and she was taking 3 tablets per day. That makes about 900 milligrams of curcumin, and that is equivalent to 30 grams of turmeric powder per day. That is huge. 30 grams is this. This is 35 grams. It's huge. You're not supposed to consume the whole bottle like that, 1 bottle per day. That's a huge amount. So no wonder, in my opinion, no wonder that she got problems. The case number 2 is a 62-year-old woman who was diagnosed with acute yellow atrophy of the liver, so severe that she was put on a waiting list for a liver transplant. She had been consuming a turmeric supplement for 8 months, the composition of which was for 1 tablet, 500 milligrams of turmeric dry extract, 100 milligrams of ginger dry extract, 3 milligrams of black pepper dry extract. She didn't take anything else, and she didn't drink alcohol. She stayed 18 days in the hospital. So 500 milligrams of turmeric dry extract is about 500 milligrams of curcumin. She was taking 4 tablets per day. That makes it 1600 milligrams of curcumin, and that's about the equivalent of about 50 grams of turmeric powder per day. 50 grams. It's almost 2 bottles of that per day. That's huge. So again, no wonder she got problems. The case number 3 was a 59-year-old man who was admitted to intensive care and diagnosed with acute liver disease during concomitant hospital treatment with intravenous amiodarone and azithromycin, that are 2 drugs, for heart failure and systemic infection. Before his hospitalization, he was taking 4 tablets per day of a turmeric supplement, which composition was for 4 tablets, 70 milligrams of turmeric powder and 7 milligrams of black pepper powder. When he entered intensive care, he stopped the supplement and his condition improved. He was also treated with NaC at a dose of 600 milligrams and he recovered without doing anything else. So the turmeric supplement he was taking was not very concentrated. It was only 70 milligrams of turmeric powder. It's not even a dry extract, so it's not concentrated. But there is black pepper associated to it that enhances the bioavailability of the turmeric. But more than that, the most important here is that he was taking chemical drugs. Okay, so the combination of chemical drugs plus turmeric plus black pepper powder makes the whole thing very toxic for the liver. We will see why with more details in just a few minutes. Case number 4 was a 45-year-old woman who visited the emergency department with symptoms of right hypochondrial pain, gastric pain, jaundice of the sclera, and dark urine. She did not consume any alcohol or paracetamol or any other medication. She was taking 2 tablets per day of her turmeric supplement, which contained 1000 milligrams of turmeric dry extracts, of which 760 milligrams of curcumin, 10 milligrams of black pepper dry extract, and 3 synthetic vitamins. The patient was diagnosed with acute cholestatic hepatitis and treated with N-acetylcysteine, 600 milligrams, 3 times per day. So she was consuming 760 milligrams of curcumin. That is the equivalent of about a little more than 20 grams of turmeric powder per day, and the bioavailability was enhanced because of the conjunction of the piperine in the supplement. So again, this is 35 grams. She was taking 20 grams. That's about this much per day. So the equivalent of 20 grams per day of turmeric powder, that is absolutely not natural. Plus, it was in combination with piperine. So again, no surprise that she had liver issues. Case number 4 was a 68-year-old female who developed a non-pancreatic cholestatic hepatitis following the use for 2 months of a product containing curcuma phytosome and Echinacea angustifolia. Her main symptom was acute abdominal pain, and the ultrasounds showed gallstones. She did not drink any alcohol, but she was taking a medical treatment that was denosumab injections. She was taking 1 injection every 6 months for her postmenopausal osteoporosis. She had taken 1 tablet per day for 2 months of a turmeric supplement, which composition was for 1 tablet, 200 milligrams of turmeric dry extracts, 400 milligrams of sunflower phospholipids, dry extract of Echinacea root 5 milligrams. Her hepatic parameters returned to normal after 30 days of stopping this supplement. So here, she was taking 200 milligrams of turmeric dry extract. That's about 200 milligrams of curcumin. That doesn't sound like so much compared to the previous cases, but it's still a lot. It's about 8 grams of turmeric powder a day. But the problem here is the sunflower phospholipids. That's the liposomal technology that makes this curcumin much more bioavailable. So here again, she had issues because of a huge amount of curcumin entering her cells. Case number 6 was a 56-year-old female presented to the hospital with jaundice and altered liver markers. The diagnosis was acute hepatitis. The patient reported taking 2 per day tablets of the same supplement reported for case 4 over a period of 1 month. She never had liver issues before, and at the same time she was taking bisoprolol, which is a medical drug that is a beta blocker. Her condition improved after she stopped the turmeric supplement. So here she was taking the same supplement as in case 4. That was a huge amount of curcumin, 760 milligrams per day. that is the equivalent of more than 20 milligrams of turmeric powder per day. And the problem here is that she was taking medical drugs at the same time. That's why she got liver toxicity. Case number 7 was a 61-year-old female presented to the hospital with jaundice and altered liver parameters. She was diagnosed with acute cholestatic hepatitis, and she had been consuming 1 tablet per day of a turmeric supplement for a period of 2 weeks. 2 capsules of the product contain 475 milligrams of curcumin, Boswellia serrata dry extract, and seaweed thallus. Intake of the product was suspended and hepatic parameters reverted to normal values. So she was consuming 237 milligrams of curcumin per day for only 2 weeks. That's not a lot, and she was, that's not a lot compared to the previous cases, but it's still a lot. It's still close to the equivalent of consuming about 7 or 8 grams of turmeric powder per day. That is a lot. She did not take any medication at the same time, but in the supplement there was a dry extract of Boswellia serrata that might explain maybe the reason of the liver toxicity, but it's just a guess. So in this last case, it's not as obvious as the other cases why she got liver toxicity from the supplement. So regarding turmeric toxicity, although the vast majority of studies showed complete innocuity in humans, experiments on rats and mice had shown hepatotoxicity of turmeric at high doses in rats and at low doses in mice. A high dose of turmeric oleoresin in pigs has also been shown to reduce weight gain by reducing nutrient absorbability, increase liver and thyroid weights, and induce histological changes in the liver, kidneys, and bladder. In human studies, dosage has also been evaluated. In one study, 100 diabetic and obese patients received 300 milligrams of curcuminoids daily for 3 months with no negative side effects. In randomized control studies, about 5% of subjects had test results showing impaired liver function, especially when treatment duration was less than 1 month. But these results are apparently idiosyncratic. That means that it is specific to the particularity of each individual. Therefore, we can't generalize from these results. What explains the toxicity of turmeric supplements, in my opinion, and according to the conclusions of these different studies, it is a combination of 3 things. Number 1, excessive and unnatural dosages. That is to say, dosages that are not achievable with normal culinary consumption of regular turmeric powder. Number 2, the artificial additions of absorption enhancers such as piperine, liposomal technology, or even nanoparticles, which further add to the overdose. Number 3, it's the combined effect of turmeric and piperine, which both inhibit the activity of cytochromes P450 and therefore prevent the liver from detoxifying chemicals. If these cytochromes P450 are inhibited, the liver can no longer detoxify chemical drugs. I quote the study. Curcumin demonstrated an inhibitory effect of a number of cytochrome P450 subtypes. Thus, turmeric can potentially interact with some conventional drugs such as anticoagulants, antibiotics, cardiovascular drugs, anti-cancer drugs, and antidepressants. Among the cases collected in Tuscany, 3 subjects reported being exposed to 1 or more concomitant medications at the time of hepatic adverse event onset. With regard to cases identified through the systematic reviews, the majority of patients were concomitantly exposed to at least 1 of the medicines listed above. End of quote. Also, many of these incriminated products contain synthetic curcumin. The negative association of turmeric supplement cost with a high percentage of curcumin suggests that the likelihood of purchasing a product that may contain synthetic rather than turmeric-derived curcuminoids may be higher with less expensive products. Finally, the production of synthetic curcumin may lead to the presence of degradation compounds such as ferulic acid, acetone, and vanillin, and solvent residuals such as isopropanol, ethyl acetate, acetone, methanol, ethanol, and hexane in the supplements, which may contribute to their final risk profile in humans. During my research, I came across a study about a new highly bioavailable turmeric formulation called curcufane, made of turmeric and fenugreek. The study shows that 1000 milligrams of turmeric of which 380 milligrams of curcuminoids of this product for 3 months did not elevate any markers of liver or kidney toxicity in 20 subjects. But I realized later that the scientists who did the study had declared a conflict of interest and were financed by the brand they were studying, so it's not a product that I would recommend as long as there is no objective study without conflicts of interest carried out on this product. My conclusion, which is a personal conclusion, is that the vast majority of people do not get problems with turmeric supplements. However, as always, I prefer to recommend using whole foods as much as possible instead of highly concentrated versions of these foods, because to me, nature is perfect, and the more we artificially isolate or concentrate molecules, the higher the toxicity, as shown in these studies about turmeric. Turmeric powder is non-toxic, whereas supplements made from concentrated turmeric can be toxic, not to mention the synthetic curcumin that is often added in low-cost supplements. These supplements can be partially toxic if taken in conjunction with chemical drugs, since curcumin, and even more so if combined with piperine, can block the detoxification process of chemicals in the liver. Personally, if I had to recommend turmeric supplementation, I would simply recommend organic turmeric powder to add to your dishes, and I would recommend avoiding turmeric supplements if you are taking any medication. So I hope this video helps. If you have any comments or any questions, you can write them in the comments. I see you in the next video. Bye bye!